How many of you have ever sprained an ankle or had horrible abdominal pain, needed to have some sort of diagnostic medical imaging done to help a doctor see what was going on? If so, you had an interaction with the radiology department. My name is Hedel Patel, and I'm a radiologic technologist, and I'm here to share with you a little bit about this field and its career options. As we take a look into the field of radiology, we will explore each subdivision within the department, as well as the different types of imaging modalities, career options, and the steps one would take in order to become a radiology tech. Radiology is a medical specialty that uses imaging to diagnose and treat diseases seen within the body through a series of imaging techniques. Some subdivisions include diagnostic, CT, MRI, ultrasound, fluoroscopy, angiography, mammography, cardiac catheterization, and nuclear medicine. X-rays or plain films are the most widely known kind of imaging. They were accidentally discovered in 1895 by Wilhelm Conrad Röntgen. X-rays are produced by transmitting radiation through a patient onto film. They are mainly used to see broken bones and to diagnose minor chest complications. Major improvements have been made over the years. We no longer use darkrooms and film. However, today we use digital imaging, which has made the process much easier and quicker. CAT scan or CT scans use greater amounts of radiation as well as algorithms to produce more detailed body imaging. CT has revolutionized imaging because of its 3D reconstruction capabilities. It's the test of choice in diagnosing urgent and emergent conditions like cerebral hemorrhages, pulmonary embolisms, appendicitis, diverticulitis, and kidney stones. MRI is one of the two types of imaging in radiology that does not use radiation. It, however, uses very strong magnetic fields to align atoms within the body's tissue. It then uses a radio signal to disturb the atoms while recording the radio frequency signal made as the atoms return to their baseline. Small antennae called coils are placed near the area of interest to collect these signals. MRI gives the best soft tissue imaging of all the modalities. Now that we have looked into some of the more popular modalities, we can talk about career options. Technologists who wish to work in any modality which uses radiation must first become a licensed RT or radiologic technologist. Once you have your RT license, you can cross-train or get additional education in order to work as a CT tech, MRI tech, mammo tech, nuclear medicine tech, or cardiac cath tech. If any of the information prior has sparked your interest, the following information will help you in becoming a radiology tech. The first steps to becoming an RT would be to research prospective schools and their prerequisite admission requirements. Make sure you have completed those before applying. Secondly, do some research to see what division of radiology you would be interested in, because it's great to start making connections within those departments while you're still in school. Most schools are 2-year certificate programs, however, there are also 4-year bachelor programs as well. Once you've graduated, you must sit for your national registry exam. You must pass in order to be accredited by the American Registry of Radiologic Technologists, better known as the ARRT. Once you receive your accreditation, you can apply for a license to work in your state. If you wish to work in a different modality such as CT, you must be licensed in that. And in order to take the registry exam for a CT, you must first complete the required competencies. On this slide, you will see some annual salary averages according to salary.com. As you move up to a special modality, the imaging becomes more complex and your exposure risk to radiation increases. With these complexities, you will also see an increase in wages. Seen here, the general average salary for an RT is $55,000, for a CAT scan tech is about $64,000, and for an MRI tech around $76,000. To summarize, if you enjoy technology, photography, and if you find joy in helping people, becoming a radiologic technologist is probably a good choice for you. Working in radiology can be personally fulfilling as well as financially satisfying. Many X-ray techs that I know lead very comfortable lives. They travel the world and love to help people. Many move up to work as lead techs and department managers, and furthermore to even become administrators and directors. You have the option of working anywhere in the country, in busy hospitals, operating rooms, surgical centers, imaging centers, doctors' offices, and even working for sports teams. The opportunities are endless in a field that will always be needed. I'm very happy to have been able to share this information with you, and I hope I was able to answer any questions you may have had about radiology. In the following slides, I have some films prepared for you to see the differences between all the modalities. Here we see CT versus MRI, and also just an MRI scan. You can see the difference in detail. On this next slide, we have a scoliosis film. You can see the Harrington rod put in the second image to help the spine stay straight. We also have a foreign body film that shows a nail going right through a patient's finger. On this slide, we see 3D reconstruction of a renal angiogram, so kidney angiogram on a CAT scan, and also a renal kidney angiogram in an MRI. You can see the difference in detail on both of them. On this slide, you see a foreign body CAT scan of the brain that has some sort of object going through the patient's eye into the skull. And on the second picture, you can see a finger dislocation. On this slide, you can see an MRI neck angiogram. What they do here is they inject contrast or gadolinium into the veins and arteries so you can follow the contrast through to see if there's any blockages. On the right-hand side, you can see a PET scan or a PET CT scan. This is a nuclear medicine procedure. On this last slide, you can see two simple x-rays. One is of a broken ankle, and the other is a broken forearm on a pediatric patient.